Hi guys, my name is Danielle LaPointe. I'm the Executive Director at Sunspire Health Hilton Head, and this is Michael Frost. He is an addiction medicine specialist, and he's also our advisor here, our medical advisor at Sunspire. And we have a great discussion for you today. We're talking about overcoming the shame of addiction as a family. I want you guys all to know that if any medical questions come up during this, we definitely don't want to answer those because we're not in the appropriate setting to do that. So we welcome you to go to our website or at least to speak with your treatment provider if you have any specific questions. But other than that, we want to open ourselves up to a great interaction with you, and we welcome you to chit-chat with us as we're going along, okay? So what are we going to talk about today?
So, obviously, we want to talk about, the disease of addiction as it impacts the family. And, this is always a tough, complex topic because even though an individual is the one that has the disease, it actually impacts the entire family as a whole. It causes ripple effects. And in turn, the prognosis of that disease is impacted by the family and the support system that a person has around them.
Right.
So there's a lot of back and forth that isn't always present in other diseases that really makes the treatment and dealing with the addiction challenge.
Right. And I started thinking about when you're talking along those lines of not just treating the individual, but treating the entire family because it's a family disease, how that looks when somebody is first coming in and learning that they have a substance abuse problem.
Right. I mean, there's always the debate or the discussion of, is it nature versus nurture? Right. Where does addiction come from? And I mean, I think we realize now that it's not an either or, it's a both.
Right.
And that the family provides your genetics, provides the biology, the predisposition, the vulnerability to having the disease of addiction. But then also the role modeling and just the way that a person learns to deal with the world around them comes from the family as well. And then in turn, the behaviors that disease creates for the person.
Right.
What we typically think of as lying, cheating, stealing, manipulating, impulsivity, need for immediate gratification, all of those kinds of behaviors. Those are really our cluster of symptoms. Mm-hmm. But those symptoms, because they are so behavioral, they're so outward, it makes having that disease so much more apparent and so much more impactful on the people around them.
Right. And I think that stuff is learned, whether it's the symptoms or the behaviors that we're talking about. And I think about in the 60s, they did a study in an elevator about how people have the ability to influence one another. And so these Confederates, or these guys, would get on, they were part of this science experiment, they would get onto an elevator, and they're dressed in regular clothes, and they're looking rather distinguished and professional and authoritative. And the individuals who didn't know that there was a camera on the elevator watching them would be standing there, and then the scientists would turn around. They just simply turn around. The individual just
you don't do it enough.
Right, it's odd, and they're like looking around, like, why are they doing this? And sure enough, 9 out of 10 times, the individual who had no idea why they were doing it turned around. And you look at Milgram's study, same time frame, obviously a very controversial study that talked about individuals taking instruction from authoritative figures to shock somebody else, to be obedient because of an authoritative figure. And I think that these are strangers, one, and these are adults, and they show how influential people can be, even when we don't want them to influence us. And the difference with a child and their parent, who they look at their parent like a godlike figure at a young age. I mean, they're influenced by mom and dad.
Without even realizing.
Exactly.
And because addiction is a disease of brain chemistry,
right.
First and foremost, that brain chemistry and that pathology leads to behaviors, right? I need to use this drug because this drug does something for my brain that my brain says it needs.
Right.
And so I will alter my behaviors. My brain, the prefrontal cortex, the executive functioning of my brain, actually gets hijacked to change my value system, my morality, to make sure that all of my actions and thinking goes towards getting that drug, getting that alcohol, getting that behavior that my brain needs. You know, and so there's this complex interplay between what's going on in the brain and those learned behaviors. You know, in the 80s, some researchers looked at chimpanzee families, and they actually showed that when the alpha male was injured or could no longer perform the role, younger chimps would come in to take the place. And as that alpha male's social position and self-esteem, I don't know how you measure self-esteem in a monkey, but as the self-esteem...
They like to look in the mirror a lot.
As that social standing started to fall, as they went further and further down the ladder, their drug-seeking behavior went up. Mm-hmm. And they actually found that when they measured that dopamine, which is the feel-good hormone, really key to self-esteem and function, was dropping as a result of that social interaction. And so it really suggests to us that the brain chemistry drives a lot of behavior, especially drug-related behavior, but that there's also potential there that by addressing the social function around the person and addressing the family, we can also positively influence what's going on internally with them.
Right, wow. You know, there's such a correlation between individuals who we treat in our fields that have a substance abuse problem and their families also having a substance abuse problem. And so when I think of some of the things that may have taken place in a household like that, how is mom to give you the type of attention and bond with you and create an attachment with you in the way that you need when she is intoxicated herself? How is dad supposed to bond with son? And these are all things that help people create a healthy self-esteem. Their interactions with mom and dad at a young age, getting those, you know, attaboy, attagirls. And so, yes, I see self-esteem and almost like, I want to call it a neurotic insecurity. And it comes across as very anxiety-driven and a lot of negative self-talk. That's what I see in this field. And I think at the core of that is from being raised in a family that, you know, there's a bell-shaped curve for a reason. Not every addict or alcoholic falls into the center of it, but the majority of them do. It's because they were raised in a family where somebody, grandma, mom, dad, who had direct parental care of that child also had an addiction issue.
Well, you know, this is, you know, the origins of addiction really come from three different pieces. I always, you know, think about it like a forest fire. Mm-hmm. The first is, you know, genetics. So you get your genetics from your family. You get your biology. Now, those genes don't make you somebody who's going to have an addiction later, but they predispose you. They give you that vulnerability. The second biggest piece is the environment with which you're in. Now, unfortunately, somebody who has an addiction, you know, and say marries somebody with an addiction, they tend to live in a household where those behaviors are just what's on display all the time. A person looks at that and says, well, I've never seen anybody respond to stress any other way than use drugs. Right. But then also, you know, the environment tends to be chaotic. There's financial stress, physical stress. It doesn't always have to be trauma in the way that people think about it as something catastrophic. It's a slow, small build-up, many incremental stressors that fit together.
Just not even bonding appropriately. Right. It could be traumatic.
Feeling lonely, feeling disconnected from family, you know, countless number of negative emotional things. Peer pressure, you know, legal issues, financial trouble. And then the final component piece is having access to a drug. Yeah. You know, having genetics alone isn't enough. A person could have the predisposition for addiction, but if they sat on a desert island for 20 years and had no access to stress and no access to drugs, they wouldn't ever show signs of addiction because they couldn't. You need those other three components there. And so when we talk about recovery, when we talk about treatment, we're really talking about influencing those two component pieces that we can get our hands around.
Right.
We can't alter the genetics, but we can work on the environment and we can work on eliminating access to that.
And what do we have control over? You just mentioned those three pieces. So genetics, we don't have a lot of control over, at least at this point with science, right? The environment, as you said, we do have control over, and access we do have control over. What if environment and access are family? What happens then?
Right. Well, that's where it gets really complicated because, I've had patients in my practice who have said, look, I know I have an illness. I know I want to get better, but I live with my family. And how am I supposed to stop doing drugs when my mother's drug dealer comes to the house 3 times a week?
Right.
And I've had people say to me, I want to get better, but I'm not sure what better means.
Right.
I don't have a perspective because everybody in my family shares the same illness. How do I get better? Again, better is kind of a relative thing, but how do I get better when that makes me different than everybody else in my family?
Right.
The family sometimes isn't comfortable with that. Oh, you're getting too good for us, or we're ostracizing you because you don't belong. You're different now than the rest of us.
Yeah.
And so you can get really complex interplay.
Mm-hmm. And there's almost, at times, at least in my experience, a point where somebody has to choose between getting better, getting healthy, getting well, or family, because there's it's so difficult to abstain from alcohol and drugs when living in a household.
Talk a little bit about the cues and the triggers of how family can in fact be your best support and your worst trigger.
Exactly. So we tell people to avoid commercials and bars and sporting events. Why?
People, places, things,
yes,
right?
Exactly, because they're going to smell it. They're going to see it. There's a ritual associated with drinking and drug use. People who are looking for a euphoria, they're looking for a change in the way that they're feeling. Like you were talking about that insecurity. I don't want to feel insecure anymore. When I'm stressed out, I want it to go away. And I know how to make it go away really quickly. And so that's a ritual. Emotions are uncomfortable. Ritual is to take something to get rid of it. You think about it, they tend to favor the same bar stool, the same bartender. Fixing is very, again, ritualistic. And so when you take somebody out of a treatment center and you put them back into a routine environment of a household.
Back to real life.
Yes. And if alcohol and drugs are a part of that routine, it's almost easier to slip back into the routine than it is to avoid it and maintain abstinence.
And you make a good point. It's not even necessarily about alcohol and drugs being in that environment, but sometimes the people.
Oh, yeah.
I have a patient who got his alcohol and drugs from his mother. Mm-hmm. And so even though the mother may not have any drugs now, and he may not have any drugs now, being around his mother, his brain is conditioned to see his mother as somebody, oh, she's around, we must be getting ready for something because she always gives us something.
Right.
There is a lot of chemical drive in these triggers. If you are on a diet and you go to fast food place and you smell the fries and you see the value menu, your mouth starts to water, your stomach starts to growl, your body says, food's coming, we got to get ready.
Right.
If I have, a brother and we used to go out and hide behind the barn and, smoke pot, and now I'm not going to use anymore, but I see my brother, my brain says, pot's coming, we got to get ready for this.
Yep.
And proteins actually get released in the brain. These
when those cravings hit.
Yeah, it's actually the cause of in part of that urge, because they're anticipatory proteins that gets the brain ready for reward. And the longer you're around that trigger, the more concentration these proteins build up, and it becomes more and more uncomfortable to the point where the brain finally goes, do something about it. I can't handle this anymore.
Right.
So, there is again, a chemical drive and a behavior.
Well, and I got to tell you, I'm so glad that they finally put craving as a symptom in the DSM-5, because I always thought to myself, there's something to that.
Right. They took legal trouble out.
Right.
Which probably shouldn't have been there in the first place.
Mm-hmm.
And then they put in actual symptoms of the illness.
The medical part.
Yeah.
And I think we're getting much more savvier to this idea that it's not just psychological, but it's also medical, like those three components that you were talking about. It's behavioral, it's psychological, and it's medical. I just want to stop for a minute and say thank you so much, you guys, for tuning in. Again, my name is Danielle Lapointe. I'm the executive director at the Sunspire Health Hilton Head, and I'm also a therapist who's worked in addictions for years. I'm passionate about this field, as you can tell. Here with me is Michael Frost. He's our doctor who is an addiction medicine specialist, and he's also our Sunspire medical advisor. We're talking about overcoming the shame of addiction as a family and how complex that can be and how difficult it can be for a family. We just covered some of the issues that kind of lead up to somebody going into treatment, the family dynamic. We really focused on the family unit being a place where there's a lot of addiction in the family. And I want to bring up a different point, because even though the average client who comes to us does have a strong history with the family, and they are going home to these chaotic homes where there's drug addiction or alcoholism in there, that's not everybody's story. There are some individuals who are returning to a home that they thought of or they think of as healthy, whether it's a spouse now, they're not an adult, a child adult, but they're going home to a marriage. But there's still some behavioral patterns that maybe I see connected to addiction, or even if it wasn't mom who was an addict or an alcoholic, but it was granddad, and some of the impact of that addiction has trickled down the family tree behaviorally. Have you seen that before?
Oh, sure. I think that's a really common occurrence. You know, a lot of times, even if a family is very enmeshed with addiction, where multiple members of the family have the disease themselves, right, it doesn't mean that they don't want to be helpful or supportive. A lot of times what I see is a person has a form of treatment, they say do very well in a treatment facility, and then they're returning home, and things deteriorate very quickly, in part because the family hasn't been taught how to be supportive. I want to help. I don't always know what that means. So I'm doing what I think. I'm throwing stuff at the wall to see what sticks, and sometimes that's not the right stuff,
right,
or the helpful stuff. Educating the family around what addiction is as a disease, and how to live with someone who's got an addictive disease, and how to support them becomes really important.
But you're setting me up to talk about enabling and codependency.
That's why I'm here.
So I think in our field, we unfortunately see that. And codependency and enabling, going back to the shame and going back to that dysfunctional upbringing and family lifestyle, trauma and codependency are one of those things that we see a strong correlation between. And so it doesn't surprise me that, and again, I'm just going to simplify this. I know not everybody's story is like this, but grandfather was an alcoholic, and then mom did not become an alcoholic. Maybe she was scared, she didn't drink that much, she's got it under control, whatever the case may be. But then grandson does become an alcoholic. And what we find is that those behaviors of maybe granddad being drunk all the time, it felt like abandonment to her. There was trauma in there.
And it gets projected.
Oh, yes. And now mom is raising her son, who reminds her of her dad, in a way that is maybe overly supportive. That's a nice way to say it. Overly supportive, like the helicopter mom has happened. And unfortunately, that's just not what I've seen to be successful. I know AA and NA, they have all these slogans, and of course you can't work in this field without knowing a little bit about that. So I look at it as they're not allowing their child or their husband, their wife, to hit rock bottom. And there's something about experiencing the negative consequences for the behaviors of your addiction that I think jars somebody and causes them to wake up. You know, guilt is a powerful motivator. And if we are constantly patting somebody from hitting rock bottom, then they're less likely to experience that guilt that will jar them into behavioral change. And I think in a household like that family tree that we were talking about, a mom could potentially be more harmful than helpful. And I hate to say that in a situation like this, without the education that you're
There's a difference between supporting somebody and enabling somebody. And I had a situation where, a young patient was being treated, and the father said, look, I want to be able to help him out. I know financially he's really struggling right now. And he said, so I've agreed to help with his phone bill.
Right.
Okay, terrific. That's a useful, helpful thing. And I'll just stop and say that also it's important for an individual with an addiction to actually tell the people around them what would be helpful to them. Families aren't really good mind readers, right, generally. So saying, hey, this would be helpful if you would do this for me.
Right.
Or I could really use support in this area. But in this case, the father said, so I've been giving him money to pay for his phone bill. Except the money wasn't going to his phone bill.
He was giving him cash, right?
So he was giving him cash. So the father thought he was helping, but was really, in fact, enabling behavior.
Right. And
so we actually worked on ways to modify that and say, okay, well, how about you have him come over to your house, you guys can write out a check together, you can mail the phone bill in together, you know it's getting paid. Or go to the phone store, and pay that bill together. That's where sometimes people don't realize that difference.
Right.
The other piece that you brought up, I think, in terms of one generation looking at the other parents, but talk about a little bit about when parents have maybe unreasonable expectations. Spouses have unreasonable expectation of a loved one who's going through an addiction.
Right.
Hey, they went to rehab and they still don't have a job and they're still not, they haven't, not doing well in school.
Right. What's
going on?
Right. And so they equate, and we just find this to be the case sometimes, and I think it's natural. Like, everybody wants their loved one to get better. Everybody wants that individual who they've seen struggle with addiction to no longer have a problem anymore. But sometimes it gets a little muddy because just being off of alcohol or drugs isn't enough. Because being better to somebody who doesn't have a substance abuse problem means being able to pay your own bills. It means being able to hold down a job. And unfortunately, we find early recovery, that 6 months to a year span when somebody has first made a commitment to stop using alcohol or drugs, to be one of the most difficult times. That's why the relapse propensity is so high. What's it, at 85%?
Can be that high, yeah.
It depends on the individual and obviously the support at home. But, we work to do everything we can to change that prognosis, to eliminate any barriers. And I think dealing with the enablement is one barrier to overcome. And I also think that setting up realistic expectations with the family through education is huge. There are going to be days where somebody in early recovery wants to lay on the couch all day. Because their brain chemistry is still normalizing. It's like that spring, it's bouncing back.
Right, we don't have the same expectations of people with other chronic illnesses.
Right.
If somebody has diabetes or heart disease, we don't make that correlation to how they do in school,
right,
or how they do at their job, or whether they keep a job. And in a lot of ways, it's unreasonable to blame all of life on having an illness.
Right.
Really recovery from addiction, like any other chronic diseases, is not to make it your identity.
Right.
It's to say, this is a chronic disease that I have, and despite having it, I'm able to live well.
Right.
And that's the real challenge.
Right.
And I think that's where this idea of fault and blame, and ultimately, we're talking about shame and addiction in the family, but really it is very easy for families to blame the individual.
Right.
This is a choice that you've made.
Right.
And that's not really true, is it?
And it's honestly, I think it's what causes the stigma, is that perception or the hurt feelings that says it's your fault. You're a bad person. You're not a moral person.
It's not really a disease.
It's not.
That's what people say.
It's a weakness. Your sister or your brother, they can drink and they don't end up throwing their whole life away. Why can't you? And so I think it's really hard for people to understand that it is a disease. And like I said, and I'll say this again till I'm blue in the face, that misconception is where I believe the shame comes from for the individual, the blame of the family.
Right. And it's not just the family. There are healthcare providers. There are physicians who don't have a good grasp on the diseases of addiction,
right.
What that actually means in terms of pathology, in terms of, this is a chronic relapsing
right.
brain
right.
disorder. And I've actually spoken to physicians who are in recovery themselves, who actually treat patients with addiction. And they've heard me talk about the brain chemistry of addiction and the genetic origins and how the brain actually structurally and functionally changes when somebody has active addiction. And they hear all of this, and they hear the science behind it. And I actually had one of them go, well, yeah, but it's not really a disease, is it? And I actually asked the person, this doctor, I said, why is it more important to you? Why would you rather be seen as having a moral failing or a character flaw
right.
than a chronic illness?
Right, right.
And he didn't have a good answer. I think it just shows how ingrained this attitude is and this misperception that addiction is something that people have, a lifestyle that people have chosen.
Right, right. And going back to what we were talking about, where it's rooted in the family sometimes because it's genetic or it's a learned behavior, that when I feel ashamed, says the addict, what am I going to do? I'm going to drink and I'm going to use drugs because I don't like those feelings, right? And so what we're doing as maybe a society...
I'm basically showing my family they were right.
Right, exactly.
It becomes a self-fulfilling prophecy.
Exactly.
My family says I'm not a good person. My family says I should be ashamed of myself.
Right.
Because I carry that shame, I drink. Because I carry that shame, in response to that, I use drugs. And then I become that
and we see
person that they say that I am.
Yep. And I think the conundrum is so a family finally seeks out treatment at a good, high-quality care treatment provider. And the client gets taught, you have a disease, man. It's okay, and there's treatment for it, and you're going to have a great life. And they get full with hope, and they can see their future without alcohol and drugs, and they can find a way to live with this disease successfully, right? And have their dreams. And then, so the thought that this is a disease is shame-reducing for the client, right? But when you start to educate the family about this disease, and you tell them that it's genetic and it's a learned behavior, what happens to mom, dad, husband, wife? They start to... their shame level goes up.
There can be some defensiveness and denial about that as well.
Yes, I agree.
It's an ongoing process to get the individual in sync, if you will, with their support system, with their families.
Right. A dynamic family therapist, in addition to somebody working with the client, I think is key, because it's almost like the family needs their own treatment goals. They need the education piece, and then they're going to need to work on the denial, the defensiveness, and all that comes up from it.
Well, we've talked about a lot about treatment in general, and I think it's important to mention that there is good treatment out there,
right? That
there is evidence-based treatment, and that sometimes people's prior or previous attempts at engaging in a treatment community can perpetuate some of the issues.
Right.
Not all treatment is the same. Not all treatment providers are the same. I think it's really important that people seek out, individuals who are licensed, qualified, using evidence-based practice to ensure that what they are getting is going to end up, helping in the end.
Long term. We're looking for long term. So I know that we're coming in at our 30-minute mark, and we can go on all day long because obviously you guys can tell how just passionate we are about helping people overcome this as a family and as individuals. I want to make sure, though, that we have some time for questions. So if you guys have any questions, I know we haven't been paying attention to all the news feed here, so I'm going to go ahead and see what's on here. Never really thought about that. What reduces shame for the addict can reduce shame for the family. And so Amber's on, you guys, and she's seeing it as hey, I can see this as being a reduction of shame in both parts. And I would agree with that, Amanda. I think there's an opportunity to see a reduction of shame with both, with the proper treatment. But I think there has to be a different path or treatment plan for the individual than there is for the family. And that'd just be my 2 cents on that. And one of the things that I love about this field is that there are no right or wrong answers. I think sometimes there are right and better answers, but as long as we're doing no harm and we're using evidence-based, high-quality, licensed care, we're going to help people find their ultimate goal.
Well, and I think it's also important to realize that a cookie cutter, one size fits all treatment is not necessarily going to end up working well. There are some common concepts and some common strategies that can apply to most people and most families, but ultimately you need that professional to guide you through your particular intricacies, your particular dynamic, and there has to be somebody savvy enough to be able to make changes as it's needed.
Absolutely.
To make sure that you're moving forward. Recovery is a fluid, always moving target.
Isn't it?
And as long as you're engaged, that goalpost should always be moving.
Right.
You're never really reaching the end. It's an ongoing journey that you're on for a long time.
Not even just the individual. Our field is. We just mentioned in, 2015 when they did the revision, craving being added, legal being taken out, because the science and what we're proving in the field is just getting more and more advanced. And I think it's going to continue to get advanced.
Right, and we need to continue with that scientific innovation with it. And
I agree. So John's pipe. He's put in a question here. Hey, John, we're glad you joined. So John's asking, how do you approach a protective parent who wants to get help for their child in what's, for them, the parents, instead of thinking what's best for the child? Okay, for example, like not encouraging travel or wanting them to stay close to them in the same environment, multiple relapse situations. Okay. So what do you think of that?
Well, I've seen this a lot. Family can be the best support, and they can also be the worst enemy of recovery. Without the proper perspective and commitment to supporting an individual, you can actually do more damage. I've had many times parents say, hey, I don't want my loved one, I don't want my grown adult child taking a certain medicine, or I don't want them staying on this, or, I know I said I would bring them and participate in helping them with treatment, but now I'm starting to put conditions on it, where I'll only drive them if they do this or that or that, or I'm only going to help pay for their treatment if I do this or this or this. It's something that really from the outset needs to be worked out and discussed so that there are no surprises. Almost having an agreement, or I don't like to call it a contract, but a behavioral agreement with the parent as well, to say, look,
we call those boundaries.
Here's what's going to help, and if you're going to be part of this process, then we need to be allowed to do these treatments.
Absolutely. I think of an addict or an alcoholic who can't, or not can't, that's the wrong way to say that, has a difficult time with moderation, has a difficult time saying no to themselves. Think of them in early addiction. I can't say no, don't go to that bar. It's really hard for me to do that. And has a problem saying no to other people or hearing no from other people. And so boundaries, we find in this field, self-protective boundaries are one of the things behaviorally that I think make a huge impact in recovery. And when the mom and dad have a very protective approach that could maybe be viewed as controlling, and I may be reading into this a little bit too much, then I think it can cause the adult child, to have a difficult time with boundaries. And they already have a problem with boundaries on their own without the family unit. So I think, just like you said, that contract, that boundary setting out of the gates, expectations, setting expectations.
Addiction is, by its very nature, a very chaotic disease.
Right.
And so one of the goals of treatment is to attempt to apply some structure and boundary and say, look, here's the box in which we're going to have to live. Mm-hmm. Let's figure out how to live well within that box.
Right. And then,
but that includes, especially not just mother, father, but spouses as well. A lot of times, that life changes for them as well, and getting their buy-in and getting their agreement can sometimes be a real challenge. And when you don't have that agreement, or it can really undermine the success of the person.
And I don't have to try to control you or try to work on my trust issues when we have those clear boundaries or those guardrails that keep our hearts safe in those relationships. So I think that's a really great question, John. Thank you. You got us thinking about some new ideas. So Sarah's jumped in, and she said, I've seen families gain much knowledge in regards to boundaries from attending Al-Anon in conjunction with individual and family therapy. I think you would get nothing but head nods over here on sober support in the community, whether it be AA or NA, Smart Recovery, Al-Anon, absolutely.
Well, I think I would also add in that, some people feel sometimes uncomfortable with those types of support groups. It's important to realize that for families as well, support can come from a lot of different avenues. It can come from church religious organizations, it can come from schools, it can come from
Bible study,
even just sometimes groups of close friends, parents, spouses of someone in addiction need as much support as the person who has the identified addiction.
Yeah. And that goes back to that individualized treatment, getting to know folks and what motivates them to change their behaviors and what inspires them to just get better. So good. All right. We've got Alino and Anilo. I just totally botched your name. I am so sorry. So I'm very concerned about what is happening to the American people with my soul and heart to the American people. Yeah. I think if I could, Mr. Bush, I just kind of mentioned that's why we're doing this Facebook Live. That's why we're spending time and energy and focus on not just treating people in our practice, but also reaching out and making people, hopefully coming alongside families and individuals and letting them know that we're here for them and that we want to see them be successful. So, yeah.
I think addiction is a chronic disease that, frankly, not just the United States, but worldwide is at a point of epidemic. And everybody, any family can be affected.
Oh, yeah.
And it's important that everybody be knowledgeable about it and realize that there are options, there are treatments, there is help available.
Right.
And to not let stigma or the idea of shame stop somebody from reaching out and getting treatment.
Right. Absolutely.
With that, I think we are almost out of time.
I think so, you guys. So Dr. Frost and I are going to be at a conference in Atlanta, October the 13th. The conference goes from the 11th, the 12th, and the 13th. It's put on by Clinical Excellence, and we're going to be speaking on this topic. It won't be as casual. It'll be a full-on presentation. And if you're in the field and you're looking for some CEUs, we'd love to see you there, get to shake your hand and meet you. If you have any questions or you want to learn some more, we'll always have some Facebook Live sessions going on, whether it's at the Hilton Head location or any other of our facilities. So feel free to like us on Facebook or check us out on our website. And it's Sunspire Health.
SunspireHealth.com,
Yep.
Sunspire Health, Hilton Head, and our other facilities across the country.
Right, absolutely. We'd love to see you online and hear from you even more. So thank you so much, you guys.
Thank you, everybody.
Have a good one.